Late Night Health continues. I'm Mark Alyn. Coming up in our next segment, Robert Clancy will be joining us. We're going to be talking about how like attracts light. I think I got that right. We'll find out more from Robert Clancy, the author of Soul Ciphers, coming up next on Late Night Health. And then Daryl and I think we're going to have some time to talk. We'll see. I'm Mark Alyn, along with the insane Daryl Wayne. We're talking about Durascience right now. And Dr. John Rubina, who is the head of scientific innovation and the U.S. medical advisor for Durascience USA. Let's talk about your 5 or 6 spokes in that wheel very quickly, and
Sure.
and to optimize wellness. What do we do?
I break it down into, I called it SOS Pi. I try to break things down so I can actually remember them. So SOSPIE. One is spiritual. One is occupational. One is social, and that means either your community and the environment that you live in. Physical, intellectual, and then emotional. And those are the 6 spokes that I think of in the wheel of wellness. They're all interconnected, and each element or dimension, if you want to call it that, each contributes to wellness. And for that wheel of wellness to be going down the right path as smoothly as possible, you need to do all 6. And like I said earlier, it's not complicated and it's not overwhelming, but these dimensions of wellness are multifaceted, and it requires each one of us. It's our obligation to live our best lives, to be our best selves, to go through each one of those. So something like spiritual, and it doesn't necessarily have to mean a specific religious practice. You can have a pursuit of harmony and self-awareness that involves things like meditation.
And does that make you healthier in general?
I think, and I can only speak for me, and I'm going to be perfectly honest, I don't meditate nearly as much as I should. When I was living in Los Angeles and it was just a very stressful environment, I meditated much more. It made me a calmer, kinder, more patient, more aware, self-aware human being. I was a much, much better human when I was practicing meditation regularly than when I didn't.
And I have a feeling that you're one of the kindest people on the planet. It's just an intuitive thought.
Well, thank you. I have my moments. Believe me, we all do. We're all human.
We are. Let's talk about supplements, and let's talk about things like the FDA and antiquated laws. I don't mean to put you on the spot, but I'm fairly outspoken. I don't believe that the FDA really serves to protect people anymore. I think it's all about making money for big pharma. You can comment on that, or you can say pass.
I agree with you. I agree with you. It's all, it all comes down to money, unfortunately. And, prescription meds have their place, certainly, and I'm not going to disparage them. But we've become so reliant on medicine. And look at the opioid epidemic that's going on now. And that is 100%, well, maybe not 100%, but it's a majority of the burden, the responsibility falls on healthcare practititioners, just handing that stuff out like candy. It's
right.
Crazy. I mean, doctors are so overwhelmed now with patients with pain that they'll just give them the meds, go away. I got to see another patient. That's no way to practice medicine.
No, it's not. And I've also said that insurance companies are telling the doctors how to practice, and they're there to make the bottom line. They're not there to make people well.
That's been going on for years.
Yeah.
It's shameful, to be honest with you. I'll tell you right now, I have never been and never will be a member of the AMA.
Oh, my.
Never.
I congratulate you.
I'm I don't want to politicize medicine. I just don't. And I agree with you about the FDA. It has a purpose and it does some good things, but it hasn't kept up with the times. Not at all. And,
we're running out of time, and we're going to have to do this again. I promise you that we will do this again soon.
I would love it.
We have a couple of moments, but as I said, are there differences in supplements? There's good manufacturing practices. Following guidelines set up by the NPA is another way. Durascience does that and more, and we're...
Oh, yes. I'm not going to get into any kind of proprietary patented stuff, but, I mean, there is no doubt in my mind. I'm very, very cognizant of this. It's incredibly important to me that we test our products not only for efficacy, but that the products that we do use are of the highest caliber.
Got it. John, Dr. John, we have to go. Durascience.com is the place to look. Durascience.com. Doctor, hold on, okay? I want to talk to you just before our next segment. I'm Mark Alyn, along with the insane Daryl Wayne. Hope you're having a great night. Join us at latenighthealth.com, latenighthealth.com. Coming up next, Robert Clancy as Late Night Health continues.